As medical treatments go, more and more of us have come to see GLP-1s as a game changer. This morning, Tracy Smith begins our series on obesity with a look at the growing potential and questions about those revolutionary drugs.
It's that season again, the most uncovered time of the year. For some, swimsuits can be an issue, but not for Carly Anderson.
I feel like I can be present. I feel like
The former elementary school teacher is now an online influencer whose content celebrates people of all shapes, including her own.
years and years ago, I started an online community called Just Wear the Suit, and it was really just encouraging women to work on being comfortable where they were. It was really about female empowerment and just feeling at home in our bodies.
But her own body was holding her back. For years, she suffered from chronic inflammation of her joints.
How incapacitating was the joint pain before?
I remember telling my husband, this is what it felt like to be old.
You were struggling?
I would wake up with severe back pain every single morning. It was to the point where I thought, well, I guess this is just life now at 46. So the medication comes in a vial like this.
Got it.
And then these are syringes.
So, after trying practically every remedy out there, Carly's doctor suggested that her inflammation might be helped by an off-label use of a GLP-1.
For you, were GLP-1s kind of a last resort?
100% a last resort. I think as someone that had done so much work myself on feeling at home in the size of my body, I was very resistant. I gave myself the first dose of this medication, and within 3 hours, I started to think, something's happening. And I could literally feel inflammation start to leave my body. It was the most wild experience I think I've ever had in my life. Within 4 or 5 days, I was having joint pain in my back. It was gone. It was gone.
Gone.
Literally gone. And then it just over time got better and better.
She says the joint pain went away even before she lost 40 pounds. Carly's joined more than 30 million people in the U.S. who are on GLP-1s. The drugs were approved 20 years ago as a treatment for diabetes, until researchers noticed that patients were also losing some pretty significant weight. There are now more than a dozen approved GLP-1 drugs, some in pill form, and there are newer versions on the way.
They're transforming the lives of my patients, their health, every aspect, chasing after grandkids, being able to tie your shoes, being able to wrap a towel around your body.
Dr. Anya Yastreboff is a Yale endocrinologist and author of Enough, a book she co-wrote with Oprah Winfrey about causes and treatments for obesity. Yastreboff says it's still too early to claim victory, but in the U.S., obesity rates appear to be heading downward, and the drugs might be useful in ways that haven't been fully studied yet.
I think over time, what we're going to see is by treating early, by treating obesity, we're going to prevent, mitigate, and treat hundreds of other diseases.
Like high blood pressure,
like high blood
diabetes.
Yes, yes. So in fact, even there are at least 13 types of cancer that are related to obesity. And it's going to take a lot more time and more studies to really understand how treating obesity will impact those types of diseases like cancer. But think about the potential of maybe in the future we'll be preventing those types of diseases, including those types of
cancer.
Yes, including those types of cancer that are obesity related. By treating obesity, if we're impacting obesity and potentially 200 obesity-related diseases and complications, these medicines will save millions of lives.
Like any drug, GLP-1s could have side effects, the most common being gastrointestinal distress. And a small group of patients report experiencing something called anhedonia, nicknamed Ozempic personality.
Welcome back to On the Pen Live. I'm your host, Dave Knapp.
Dave Knapp, founder of the obesity care podcast On the Pen, says when he first started on GLPs, he lost interest in things he used to be obsessed with.
Did you have an issue with Ozempic personality or anhedonia?
It's just that a lot of the things that used to interest me, I could take or leave. And interestingly enough, the biggest tip off for me was Chicago Cubs baseball, something that I had followed very closely for many, many years. And I realized it's been a couple years since I really followed it at all.
So for you, when you adjusted your medication, did the anhedonia go away?
Yes, I noticed after a few weeks, my head started to clear up. The sun started to shine a little bit brighter. The birds chirped a little bit louder. I noticed that my zest for some of those things started to come back, including Cubs baseball, even though it was just in time for them to hit a big losing streak.
Of course, another issue with these medications is cost. While Medicare and Medicaid will start covering these drugs this summer, many patients on private insurance can't afford a once-a-week shot. That's one of the reasons a doctor at Scripps Clinic in San Diego is studying ways to get around that.
Why'd you decide to do this study?
This is the number one question patients ask me. Do I have
Obesity specialist Mitch Bierman found in a very informal study that some of his patients maintained their weight loss even if they spaced their weekly shots out to 2 or 3 times a month.
It's not a randomized controlled trial, and in particular, it's not a controlled trial. This is just people's weight, before they started, and then, once they started doing every other week.
So now, if a patient comes to you and says, hey, do I have to be on this for the rest of my life? What do you say?
I tell people that they don't have to be on it every week for the rest of their life. Most people who reach a normal weight on Ozempic or tirzepatide, Zepbound, semaglutide will maintain that weight if they space it out to every other week.
He says he hopes to run a clinical trial in the near future.
I've cut like a minute off my mile. That's pretty significant.
That's a lot.
Anyone who runs knows.
Yes.
That's a lot.
Yes, I would be happy cutting 15 seconds off my mile,
Right.
like a minute
As
off
a
your
distance
mile.
runner, Carly Anderson may be setting the pace for the future of GLPs. To her, it's not about what she's lost, but what she's gained.
I thought, okay, the worst case scenario is I take this medication for, it's a weekly dosage. I take this medication once or twice, I feel awful, I don't like it, and I never take it again. The best case is that future me thanks current me. And I remember saying to someone, what if 6 months from now I look back and say this is the best thing I've done for myself?
So big picture question, how life-changing has this GLP-1 been for you?
It is mind-boggling how different I feel every day. Every single day.